Welcome everyone to the third of the Sunday Conversations with Mass ME, presented by the Massachusetts ME, CFS, and FM Association, a functional medicine approach to complex chronic illnesses. My name is Carrie Lang. I am a leader of the New Art Therapy Group for Mass ME CFS, and I have also spent 6 years working at Spalding Rehabilitation Hospital as a mental health manager for those with Lyme disease. In addition to that, I have experience in the last 2 years running support groups for those with long COVID. And I'm excited to be branching out and working with this amazing organization now. And I also have a private practice working and doing consulting and mental health counseling on my own. Our featured speaker today is Dr. Andrew Lenhart, a functional medicine doctor who practices in Beverly, Massachusetts. We will also hear from Sharon Seamus, a member of Mass ME who has consulted extensively with functional medicine doctors for her own care. Andrew Lenhart, MD, is a board-certified family doctor with a background in functional and integrative medicine. He is the author of 2 books, The Best of Both Worlds and Emotional Intelligence in a Complex World. Dr. Lenhart is on the faculty of Tufts Medical School, Endicott College, and Yale University, and has been teaching medical students and nurse practitioner students for over 15 years. He has developed the algorithms used for the Root Finder tool at Complex Health Solutions. In his personal life, he is married with 3 sons and 2 Pomeranians. His interests include pickleball, bridge, and exotic travel. Dr. Lenhart, thank you so much for giving us your time this afternoon. It's all yours.
Thank you so much, and I'm glad to be here. I will now share my screen. Okay, let's see. Okay, so moving along, give a little brief background. I've been in medicine for 22 or 23 years, and there are different things that got me into integrative and functional medicine. One was chronic Lyme disease, and the other was, on a more personal note, oh, there we go. Okay. So, the presentation today will discuss fatigue, and part of the goal is to differentiate between the traditional medical approach to fatigue and the functional medicine approach to fatigue. In addition, I will try to differentiate between those who meet criteria for ME/CFS and those who would have chronic fatigue but would not necessarily meet criteria. So we will start, after a brief introduction of functional medicine, with several case studies. And it's important to note that the case studies we're going to start with are not, they're very common scenarios, but they're not people that would meet criteria for ME/CFS. But I think the cases will be very useful to introduce the functional medicine patient-centered, science-based approach that empowers the patients and practitioners to work collaboratively to address the underlying causes of disease and promote wellness. One way to think that I would think about functional medicine is trying to take the best of the naturopathic principles that tend to be holistic and collaborative, but also the science and evidence-based concepts from traditional medicine. So as much as I try in my career and in my daily medical life to not create a adversarial us versus them relationship, it can be somewhat challenging because the 2 paradigms and the 2 approaches can be very different. So allopathic medicine has made tremendous strides and does some things very, very well, but it tends to be fragmented, it tends to be hyper-specialized. And the way I was trained back in the 90s and the way students are still trained today, most of the time is to make a diagnosis, and to make a diagnosis that is managed with pharmaceuticals. It's surprising to many patients that physicians and nurse practitioners don't have a lot of training to try to understand. My apologies. Oh, sorry. Okay. So we're not going to get too much into statistics, but I think there's benefit of giving some context and perspective. As everyone in the group knows, I'm sure that ME/CFS and people that meet criteria for chronic fatigue syndrome is a large group that is increasing over time and is almost certainly underestimated. It would depend on what criteria would be used, but I think one of the major benefits is that criteria have been established for ME/CFS. It's on a big scope, but then in the bottom of the screen, you know, it reflects how common chronic fatigue is in our world. Certainly one of the most common presenting complaints to a primary care office. So the first case that I'm going to review is a 40-year-old male. Now, all three of these cases are real cases, and I chose them, as I said before, because I think they show the functional medicine approach, and I think they show well the contrast between traditional and functional medicine. They're all based on real patients I've seen over the years, and these are not rare isolated scenarios. These are incredibly common scenarios of the three cases I will present. So the 40-year-old male comes in for evaluation with a long list of issues and complaints to be covered in the 15-minute primary care slot. So I used to work in a practice. I was a medical director, and my patient panel got up to over 3,300 patients. And it was during this time when I became interested in chronic complex cases and mystery illness cases and tick-borne disease and chronic fatigue syndrome and fibromyalgia. And so there was a fundamental incompatibility with me being able to give people proper attention into this slot. So that's why I included that element. So what he reported in this visit from just over 10 years ago was anxiety and hypertension, insomnia, regular heart palpitations, constipation, muscle cramps, and fatigue. Now, as some of you know, and many of you don't know, in the medical jargon, there are certain terms that are used, and for most of my medical career, the term essential hypertension would be used. Essential in this case means not only that there's no appreciation of the underlying root causes, but that there will also be only minimal attempt to understand why a person develops hypertension. The way I was trained back in medical school in the 90s is if somebody came in and had high blood pressure on multiple occasions, we would check them for chronic kidney disease. We would check them for elevated hemoglobin counts. And then if those two basic tests were negative, we would diagnose them with essential hypertension and start them on medication for life. But there's always more to that story. Over the prior few months, before he had come into this visit with me, he had seen a psychologist who diagnosed generalized anxiety disorder. He was started on Celexa, SSRI medication, originally developed as an antidepressant, but as most of you probably know, this group is used for chronic anxiety. Put on trazodone so he could sleep. He also saw a cardiologist who did a fairly standard workup of somebody with recurrent palpitations, heart monitor, echocardiogram, and started a beta blocker. This medication, as with many medications, has side effects, and fatigue being among the most common. So this person was trying to live a healthy life, and the beta blocker fatigue made it more difficult for him to exercise. He had seen a gastroenterologist who diagnosed constipation predominant irritable bowel syndrome and recommended daily Miralax. I would say irritable bowel syndrome is the poster child of functional medicine, of what I used to refer to as a pseudo-diagnosis, but I think some people take that as being a disrespectful to them. Whenever I would use that term in the past, I never meant that the person didn't have real chronic issues. I just meant that irritable bowel syndrome was really not much of an answer. In the overall medical world, it basically means that the person doesn't have any serious underlying causes, which is incredibly important, but that there will be no further investigations in terms of why they have gastrointestinal issues. So he was put on a daily laxative. His regular primary did some blood work, and then recommended hydration for muscle cramps. My estimate for this period of time of medical care was somewhere up over 2,500, but that's only for the consultations and tests that were being done during this period. It doesn't even include what the costs would be over time for medications or the other costs to his health and well-being. So at that time, from a functional medicine perspective, this is early on in my functional medicine career. The overwhelming likelihood was that certain factors like stress, alcohol, exercise over time had depleted his minerals, different minerals, and that those deficiencies and imbalances were the primary cause for most or all of his health problems. Now, of course, I've learned many, many times in my medical career to be very careful with planting a flag in the ground and declaring victory. So, but at that time, I thought there was a very high likelihood that this was the cause. One of the most important principles, so one of the most important things that I've learned beyond my medical training was the importance of magnesium, potassium, and minerals, and like nutrition and leaky gut and gut health and some things that really still aren't covered in medical education. But probably the number one reason why these issues get no attention in medicine is because 99% of medical professionals don't know that if you check blood levels of magnesium and potassium, et cetera, that they do not tell you whether the person has deficiency. So a person can have chronic progressive deficiency for 5 years or 10 years or more, and the body, through its homeostatic mechanisms, will maintain blood levels in a very tight range. So I started him on a good form of magnesium. There are many forms of magnesium, but magnesium glycinate is particularly good for anxiety and sleep, in my experience. He started 2 magnesium capsules and one of my all-time favorites, which is concentrated mineral tablets, because they have a very good broad group of minerals and very inexpensive, $12 or $15 typically for a bottle. We have one in the fridge right now. So the total estimated expense for this approach was $40. Within a couple of weeks, his cramps and palpitations resolved and his sleep was improving and he was able to stop the trazodone. Within a month, his bowels were soft and regular and he stopped the Miralax. Within a few months, his blood pressure gradually improved and normalized, and he was able to get off the beta blocker. He did stay on Celexa. So one of the most important principles of integrative medicine, from my perspective, is to not be dogmatic. I certainly see people that only believe in the traditional pharmaceutical approach, and I see people that only believe in the natural approach, and they would never take a pharmaceutical. And my goal is to work with any or all of them. And the Celexa helped him, and so he wanted to stay on the medication, no problem. Okay. Case number 2, another very common scenario. 45-year-old woman comes in with fatigue, brain fog, depressed mood, unexplained constipation, and difficulty losing weight. She had a very typical set of labs done, which probably most primary care providers would do this almost identical set of tests, and 99% of the time, maybe not quite that much, but 95% plus, all of these labs would be normal. So more and more these days, and we see that people are taking more control of their own health, and they're doing more reading and more research. So she wondered if maybe she had a thyroid condition, but she was told, no, I'm sorry, I don't care what you read on the internet. I don't care what your friends have told you. You do not have a thyroid condition, because the basic thyroid test, TSH, was normal. So eventually she demanded to see an endocrinologist, who graciously repeated the TSH, and most endocrinologists will do one extra blood test, which is the T4 level. They were normal. And she was told that she potentially would meet criteria for chronic fatigue syndrome, but there was really no treatment. And she should go out and exercise, which of course this is difficult to do when you're feeling exhausted. The functional provider, which is me, I'm not sure why I word it that way, but I ordered some other labs, which is almost always the case with a functional medicine person. I mean, they almost 100% of the time, we would do other tests that haven't been done. So it was found that she had positive Hashimoto's markers, and her active thyroid hormone level, which is free T3, was low. So this is a scenario I've seen so many times over the last 10 years. You know, I wish I could go back in time and keep a spreadsheet with all of these different scenarios so I could keep track. But so the goal, of course, in functional medicine is to try to figure out why she would have a low T3. I mean, we can't go through those. That's a totally different subject matter that we couldn't cover. But so there are many reasons, long list of reasons why somebody would have a thyroid problems, many reasons why people don't convert T4 to the active T3. In this case, she had Hashimoto's. Most doctors and endocrinologists either never check for Hashimoto's, or they'll check it one time and then never check it again, because to them, it doesn't alter the management. To a functional medicine person, it would be very different. So one of the most important questions for me early on in someone who has a thyroid condition is whether they have Hashimoto's, because that tends to split our approach a bit. So there are many root causes and contributors to Hashimoto's: leaky gut, non-celiac gluten sensitivity, Epstein-Barr virus, oxalates, etc. I would say, just as one of the many things I've learned, is the number one variable in reversing Hashimoto's, in my experience, is the person avoiding gluten. Again, I wish I was keeping track of it, but I'm pretty sure that of the roughly, let's say 25-ish women who have had their Hashimoto's reversed, all of them, or almost all of them, had to give up gluten to achieve that. And no patient I've seen that's not given up gluten has been able to reverse their Hashimoto's. Again, I don't know that this is literally true, but it's pretty close. So as is often the case, not only is the assessment is different and the testing is different in the functional world, but the treatment is often different. So I found over the years that name brand Levoxyl, instead of the generic levothyroxine, can be more effective. I actually learned that from one of my patients saw a different functional person, and that was what they did. And I learned that a couple of years ago. So, and it's generally covered by insurance, which is also a shocker. But so name brand Levoxyl and liothyronine, which is T3, worked very well for her. Her fatigue and brain fog got better. And again, this is a very common situation. The third one was a very dramatic case from just over a year ago. My practice is embedded in a larger primary care practice, so I'm sort of the oddball, doing things on my own. And occasionally the other practitioners will send somebody to me, or the person will end up on my schedule if I have openings. 35-year-old had been in the hospital a couple of times for pulmonary symptoms, cough, shortness of breath, phlegm. She saw a very good pulmonologist, very good infectious disease specialist. Everyone was befuddled. She actually was in the intensive care unit during one of these admissions. When I saw her, she still was very sick. She had cough and breathing, and she was exhausted and brain fog and constipation and sinus issues. And my review of systems is different now than it used to be. So I'll often ask questions that I would never have thought to answer back in the day, but okay. So again, my initial impression, which is sometimes right and sometimes not right, this all takes a healthy dose of humility on a regular basis. The most likely explanation, because she was on antibiotics and because she was on steroids, was that she had systemic fungal overgrowth. Now, in this situation, it probably involved her gut, her lung, and her sinuses. I would say for people with systemic fungal overgrowth, lung involvement is fairly uncommon. So that was a relatively unique element for this young woman. So we did a fairly standard approach that probably most naturopathic integrative functional providers would do, at least in terms of the diet, cut back on sugar and foods that turn into sugar. There's a probiotic that's gaining popularity every year that many of you have probably heard of, which is Saccharomyces boulardii, which has healthy yeast as opposed to healthy bacteria. There's a name brand Florastor, but there are many other brands out there. I put her on oral antifungal fluconazole. In my practice, I'm always trying to decide between the prescription options and the herbal options. And again, I resist any kind of dogmatic approach. I'm trying to learn from everybody I can. I'm trying to learn as much as I can with as much depth. And I'm willing to use any and all options available as long as they're safe and reasonably priced and effective. So again, I alluded to this earlier, but there really needs to be more collaboration between the worlds. Sometimes it feels like us versus them, but we really need, sometimes I'll say to my patients, how many smart, dedicated people are there in the field of medicine? We have all of these tens of thousands, hundreds of thousands of people. We really need to harness the dedication, the intellect, and the background, and the teaching and training of all of these people, or as well, not all, but as much as we can to make the most progress on things like ME/CFS and fibromyalgia. So, I've been teaching students for a long time, and it's frustrating, but I really do not see much collaboration. The worlds are still apart and seemingly growing farther apart in most situations. I give a few examples. Why do the endocrinologists, why won't they order the active T3 level? I've actually asked a few of them. They either didn't answer me or gave me some unsatisfying answer that made no sense to me. But I don't understand, if you were an endocrinologist, why you wouldn't want to know the active level of thyroid hormone. It seems very obvious, very self-evident. The insurances cover it. I think what would happen if the endocrinologists start ordering free T3 levels, they would be stunned, because 20 to 30 to 40% of their patients might be on the low side and undermanaged. Another one that just blows my mind, and I just can't, it's like a seed that's stuck in my gum. I just can't understand. If it's well accepted that antibiotics and steroids can cause thrush or it can cause a vaginal yeast infection, why in the world couldn't it cause fungal overgrowth in other areas of the body, especially the GI tract, which would seemingly be the most vulnerable area? But nobody in the traditional medical world ever, in my 20-something years of medicine, has taken any interest in this at all. And I could, these examples I'm putting up are just some of the more common ones. I could probably spend an hour on this kind of thing. Another one, which sounds like for the people that are here, tick-borne disease, chronic Lyme disease, very complex, very controversial subject matter that I've been in the middle of for 20 years. People will say they'll check antibodies for Borrelia burgdorferi and say, well, we ruled out Lyme disease. Well, it doesn't make any sense at all. It's actually to the point of absurdity. There are, by my counts, and people in the audience may have some up-to-date numbers, but there are 10, 12, 13 different Borrelia species, 20 plus Bartonella species, 15, 20 plus Babesia species, Ehrlichia, Anaplasma, different viruses you can get from a tick. So how could you possibly do this very basic ELISA test for Borrelia burgdorferi and then call it a day and move on? I think it just makes life much easier for the practitioner to say, well, we ruled out this and we ruled out that, and but people need help. So that's just not good enough. So very important for me in my medical career, again, this is an element of humility. Like, we all in the medical world need to be very open and upfront about what we know, what we don't know, what we understand, what we don't understand. And when there are scenarios where we're wrong or we look at things the wrong way, I don't think it's that much to ask. We have, like any of us in any realm of our life, we have to be willing to accept new ideas. So when I got into functional medicine, whatever it was, like 10 or 11 years ago, I remember I was making a lot of effort to understand the root causes, and the patient came in and said, oh, how long have you been doing functional medicine? And I said, what's functional medicine? So I had never heard the term back then. I didn't know what it was. So I went home that night and looked it up, and I said, that's exactly what I want to do. But when I get into functional medicine, I actually, for many years, I figured, okay, well, people who have chronic fatigue, people who have chronic exhaustion, people that are struggling, people that are frustrated, they have brain fog, they have depressed mood for good reason, for many different reasons. The people in this group, if they go through a functional integrated naturopathic workup, that we should be able to understand what is the root cause. Like I used to say to people, well, of 100 people that meet criteria for chronic fatigue syndrome, my guess is that 10% of them have a thyroid problem, 5% of them have low thyroid, 20% of them have chronic tick-borne disease, 20% have mold toxin illness. Some of them have Epstein-Barr, some of them have heavy metal toxicity, many of them have combinations. But I've had to take a step back and see that the ME/CFS group seems to be a fundamentally different one. And so I've had to come around and say, through experience, that I've helped a lot of people who had chronic fatigue, and I've helped a lot of people figure out their root causes. But of course, like I can only assume, like most practitioners, I have people that don't respond as well. And almost all of those people would fall under the ME/CFS fibromyalgia category. So the next couple slides, it's a lot of text. I have a friend of mine who I asked him to look through the slides and say, tell me what you think. And he said, what are you doing at the end? You have all this jargon and information. I don't care how smart the people are, you're just going to overwhelm them. So part of the reason why I left all of this text and jargon is so it can be a reference point. For those of you who are interested, you can take the time to look at this information, read it through yourself, do some searches on some of the researchers that I'm going to discuss. So long haul COVID, many or all of you have heard of this phenomenon, and there's a lot of hope out there, including from me, that these researchers around the world that have become focused on long haul COVID are going to understand some very important root causes that are relevant to ME/CFS. Whether these scenarios are overlap completely remains to be seen, but it's fascinating to me to see what they're emphasizing, what they're pursuing. So long haul COVID patients, which is an estimate of about 30%, there's a wide estimates of who meets criteria for long haul COVID. Same way there always would be a range for ME/CFS and other diagnoses, but fatigue, cognitive impairment, muscle pain, joint pain, shortness of breath, heart palpitations, sleep difficulties. I mean, it really sounds not as much autonomic dysfunction by my understanding, but it really sounds like there's a lot of overlap. Researchers have focused on many potential contributors, and even so, being in medicine for as long as I have, and being in the chronic complex mystery illness cases for as long as I have, the researchers are pursuing so many areas that the people in the functional world and similar have been pursuing as well. So the question is it a chronic infection? Is it that the virus puts stress on the body and chronic viruses like Epstein-Barr reactivate? Is it that the COVID-19 virus triggers an autoimmune response? Was it all of these things? How do we compare it from person to person? So these are not new ideas, but probably the most important development that it's not unique, but that stands out is the idea of a virus triggering an immune inflammatory response, causing protein and sludge and deposition in the arterial system with microclots that then deprives the cells and tissue of the body with blood, oxygen, and nutrients. So this is a major focus. Again, I'm not going to read the whole thing, but I have a blog that I'm almost done with that really explores some of these ideas and some of these root causes. And the long haul COVID research not only could help us understand ME/CFS and fibromyalgia, but potentially, because amyloid's involved, potentially Alzheimer's, other inflammatory processes, other autoimmune conditions. I mean, the sky's the limit. So one of the most important researchers is a woman named Recia Pretorius out of South Africa. I'm fascinated. I'm actually connected with her through LinkedIn, which is like, for me, like she's like a celebrity to me because of the work that she and her group are doing. So the fact that she sends a reply to me in LinkedIn is like, major coup. But so and I'd love to know how they chose their regimens. But anyway, her regimen is aspirin, which is a platelet agent, because platelet aggregation is part of this process in the arterial system. Plavix, which is a prescription platelet agent, and apixaban, which is a new blood thinner. Many of you probably know that everyone used to use Coumadin, and now there's these new novel agents, and apixaban is one of them. So however they did it, her team, this is what they chose. And within a month, the long haul COVID reports 90% improvement. Now, these things have to be corroborated, reinforced, repeated. So another important group is Bruce Patterson. He's been a researcher in the immunology, virology world for, I think, 25, 30 years. He doesn't look that old, but he must be taking good care of himself, because I think I've seen him interviewed, and he's been doing this work since early HIV days, by my understanding. So one thing that he and his group are doing is they have this cytokine profile called InCell DX. They look for different immune markers. Again, modest, it's a lot of medical jargon. It gets very, very technical. I saw him interviewed and I was, my head was spinning for half of it. But to try to identify reliably who meets criteria for long haul COVID, same way researchers have worked very hard over the last 5 or 10 years to find the most common markers for people with ME/CFS. And I think part of the benefit of that is to prove to the small group of cynics and skeptics in the medical world that ME/CFS is real and common and important and deserves a lot of attention in the medical research world. So Bruce Patterson has an ongoing study. He keeps adding. I have one patient who's actually in his study, very smart young scientist. And Patterson chose a very, very radically different approach to treatment. He's using Maraviroc, which was originally developed for HIV, but Patterson knows that world very well. So he understood the mechanism of action. And based on their research, long haul COVID, it looked like it would work on the immune inflammatory response. And also interesting, he uses Maraviroc with Pravastatin. Pravastatin was one of the original statin drugs. One of the things I tell people is that most people think that statins reduce cardiovascular risk. And I know people in the natural world are very hostile against statins, but there's the medical world that loves them and the natural world that hates them, and then there's me in the middle trying to sort it all out. But statins do reduce the risk of heart attack by 30 to 40%. Now that's a manipulation of the statistics, but that is true. It's been shown over and over and over again. Statins do not reduce the risk of heart attack because of their cholesterol lowering properties. They do lower cholesterol, but the primary benefit is almost certainly the immune modulatory, anti-inflammatory benefits of the statins, which I'm sure Patterson knows very well. So he puts it in part of his regimen. He's also doing very well. He's also showing very good success. He noticed that that people had a much faster response. They improved more quickly if they had been immunized. So again, another controversial subject, but and not to say that this alone says people should be immunized, but it was just an interesting byproduct of his work. One thing, just to go back for 1 second to Pretorius's work, which I wish I put in the slide, is I think it was either the #1 predictor or definitely one of the most important predictors of who would get long haul COVID was people that had important variants of the C677T variant of MTHFR. I'm sure that many in the group have heard of MTHFR. It's been around for a while. Yet another issue that traditional medicine doesn't really care about. If anything, the functional integrative naturopathic world maybe cares too much about in certain situations, tends to exaggerate the importance. But MTHFR, the enzyme that converts B9 folate, folic acid to methylfolate within the methylation cycles, the C67T genetic variant is known to increase the risk of strokes and cardiovascular events. So that really wasn't necessarily surprising. Also, why are people who are obese, why do they have the highest risk of COVID complications? Probably because the more obesity, the more estrogen, the more tendency for blood clots. So in summary, we really need more research. We need all hands on deck. We need the smart people in the natural world. We need the smart people in the traditional world. We need funding. We need collaboration. I think we really need the holistic, broad perspective of functional medicine because it really does not make sense to take this fragmented system by system approach. And the hope is that long haul COVID research is going to move us into a completely new era of understanding and treatment. It's very exciting. It's one of the most exciting developments. It's bizarre to say that we have a global pandemic, but I think there's a very good chance that's going to happen. I wrote the cell danger response in there just to slip it in, because that's another one. If people haven't heard of the cell danger response, very important issue that's been researched by someone named Robert Navio out of California. Brilliant person, really complicated, but that will likely stand the test of time, and will a viral triggered cell danger response where people are stuck is probably part of these issues as well for the ME/CFS fibromyalgia group. Thank you very much.
Dr. Lenhart, thank you so much for this presentation. You've covered a lot of information, and I think we all learned a lot. And I just want to echo, after working with long haulers myself at Spalding Rehab and hearing all the research coming out, it definitely seems like there's some hope that this can inform other populations like ME/CFS and Lyme disease too.
Absolutely.
Yeah. Let's go now to Sharon to hear her story. I'll turn it over to you now, Sharon.
Thank you very much, Carrie. I do want to say I really appreciate Dr. Lenhart's presentation, and agree with pretty much everything he said. I think he's doing, and I have never met him, but I think he's doing an amazing job for us. I got involved with functional medicine when my daughter became ill her first year of college. She came home after her freshman year and was very ill. She was diagnosed by psychiatrists with bipolar, inattentive ADHD, and post-traumatic stress disorder, which was very strange to us because she really hadn't had any trauma. We took her to 22 different doctors. She was put on 9 different psychiatric medications. She gained 30 pounds because of the medications. She lost 30 pounds, and she was just a mess. And it was before the Affordable Care Act passed, so she had to stay in school to be able to stay on our insurance. It was a very difficult time for our family. I finally started to learn that nutrition might help the brain, and I was pointed to a naturopathic doctor at Bastyr University in Seattle, where we were living at the time. And he figured out that she had multiple food allergies. She had celiac disease. She had Hashimoto's that she was able to reverse eventually with a gluten-free diet. And she had just a deficiency in so many things. And he actually was able to replace what she was on 3 psychiatric medications when she started to see him. And he was able to replace what the drugs were doing with nutrients and get her so she was functional again. And she went back to her 4-year college after an absence and got her PhD in biochemical and molecular nutrition, and now works for a biotech company up in Seaport here in Boston. So it was a very, very dramatic difference that we saw, and it really made me believe in nutrition and naturopathic and functional medicines. I really think that it's, as Dr. Lenhart said, it's not just one kind of medicine or the other, allopathic, I call it conventional medicine versus functional medicine. But I really would like to see providers working together with a really big box of tools to help all of us. You know, it doesn't matter what our problem is, but I find in the ME/CFS patients I know so many times, you know, they've had normal test results. The doctors are used to this big differential diagnosis problem, and then where they find where you fit in the grid, and then they find the drug that applies to that condition. And it just doesn't work that way in such a complex disease. On my journey, which has been over the last 6-7 years, I have seen both MDs who are functional medicine doctors, as well as naturopathic doctors and a couple of DOs. So, and then chiropractors can also do functional medicine and nurse practitioners. So I have found it's not so important which initials the doctor has, but it's the type of thinking that they have. Particularly, I've heard so many wonderful stories from MDs like Dr. Lenhart, who really knew that there was more that was needed for them to be able to help their patients. And I really applaud the efforts of Dr. Lenhart to do this. I currently see here a functional medicine MD here in Massachusetts who is a board certified OBGYN, and she too felt there was more she could be doing and went to the West Coast and got a lot of education. I find doctors who are educated from the system, the Institute for Functional Medicine, as Dr. Lenhart was quoting, are really the best. And then as far as naturopathic doctors, I find that doctors from Bastyr University, and there are some here in Massachusetts, have been tremendously helpful to me, but there are others as well. For my case of ME/CFS, I wanted to give you a little bit of an idea of how I've used functional versus conventional medicine, to a little bit of a contrast. Originally, when I got ill, I went to 12 different MDs, and they just were not helpful at all. They, a couple of them wanted to send me to a pain clinic, and I said, I'm not in pain because I really don't have the fibromyalgia part, but I was sleeping 16 hours a day. I couldn't see straight. I couldn't read anything and comprehend anything. And I was just tremendously ill. So while I was trying the MDs to try to get help, I was seeing a naturopathic doctor, the same one that my daughter had seen, and he started to run tests and find problems. And so I wanted to go through the list of problems that were found, just to illustrate how complex ME/CFS is. And I'll tell you how much help I got from functional versus allopathic doctors. I have Hashimoto's and low T3 syndrome. So that was functional medicine doctors helped me with that. I'm celiac, so no gluten. That's functional medicine and helped me with that. I've got low hormones, DHEA, testosterone. Functional medicine doctor helped with that. The functional medicine kind of approach wasn't as, and the natural treatments weren't as helpful with the viruses that I had, like Epstein-Barr, HHV6 cytomegalovirus. So I really needed allopathic, the traditional drugs to be able to get help. I used antibiotics for 2 atypical pneumonias I had. I use an allopathic approach. I get gamma globulins for immunodeficiency. I've used functional and conventional medicine for autoimmune POTS and mast cell activation. I wasn't able to take Mestinon, the main drug for POTS, so I found a supplement that pretty much has the same function, and it's cheap and it's working well for me. I had a lot of nutritional deficiencies, so functional medicine helped with that. I also had, it's a nutrient deficiency, a biochemical deficiency, but somebody made a drug out of it a few years ago. So I'm now prescribed that drug, Kuvan, which is helping me tremendously with my energy. Hypercoagulation, I've used allopathic medicine for that. And I got mitochondrial dysfunction. So I've been to conventional doctors who've been unhelpful with it. They recognize I have it, but I've used a functional medicine approach with nutrients to really help that. And then I had a little bit of mold toxicity, which conventional medicine really doesn't recognize too much. And I got help from functional medicine. So it's really been a great approach for my ME/CFS. In my personal life, my husband was recently diagnosed with cancer. We're dealing with a major Boston premier institution. It's a not so survivable cancer. So we've done a lot of research on chemo, radiation, surgery, and then a lot of alternatives that can increase survival and have better outcomes. One of them is high dose intravenous vitamin C. There is a lot of research, and it's got evidence behind it, but this institution told us that there was no way that they could possibly give something as simple as vitamin C to my husband. So we are looking at going back to Seattle, where we see MDs and naturopathic doctors practicing together and combining the best of allopathic and functional medicine. But I really feel it's not, a black and white thing. It's figuring out the root causes, figuring out the problems, and then patiently going through and fixing them. And it's just been a very powerful approach. Thank you.
Thank you, Sharon, for sharing your experience. I'm sure our audience found it helpful to hear what you've done and some of the tips you've shared. And I'm so sorry to hear about your husband as well.
Well, just part of life, just like ME/CFS.
Yeah. Well, we're going to now turn to the Q&A portion of this presentation. If you haven't already, please feel free to submit your questions in the chat and we'll go ahead. I'll start off our discussion. Hold on one second, just pulling up my questions. There were quite a few questions about COVID, so I think we tried to organize them as best as we could. So the first question goes to Dr. Lenhard. Do you have a particular view on the pathology of ME/CFS and fibromyalgia, or do you have any particular treatments for ME/CFS and fibromyalgia? I think you kind of covered that a little bit, that it's always patient specific according to a lot of things, but.
Yeah, so I'll just give a summary to, I guess, reinforce what my approach would be. So if somebody came in, I'm blessed now that I have a small group of patients and I have 60 minutes minimum, so I can do a full intake and spend much time. But so I take them through the process like Sharon was describing, and I think everybody needs to have the basic approach. I mean, hey, sometimes somebody comes in and you do the basic labs and you hit something and right off, so there's almost like layers to it. So we start with the basic approach, which is fine. And, one of my goals of staying in the system is to get as much covered by insurance as I possibly can, because I know how expensive functional naturopathic integrative, it's nothing nefarious, but just the way it is, so I stay in the belly of the beast to try to get as much covered as I can. So then I'll do my functional approach and do a sort of another round of testing. It's like concentric circles coming out, and then potentially if we're left with ME/CFS, meaning, but as Sharon alluded to this, it is a slow, patient, methodical process that takes 3 months, 6 months, a year to really go through, because there are so many different underlying causes and contributors that are really so different from person to person. It really takes so one of the things I've been working on, and you mentioned in the introduction. So for over 10 years, I've been working on a system called Root Finder that uses algorithms. So out of 30, I think we're at 30 or 31 root causes, the system will make predictions regarding the most likely top 5 causes for each person. And so that makes the process much more efficient for me. So that's included in the root causes that are predicted is fungal overgrowth, mold toxin illness, mast cell activation, oxalates, limbic system dysfunction, low thyroid, low cortisol, mineral deficiencies, tick-borne disease, so the algorithms are always being adapted, expanded, verified. We're adding root causes to try to make the system more useful, but that makes the process much more efficient in my experience. And that was the goal. The goal of the system is, if the system predicts to the top 5, it's much more likely that that is an active problem and the person will feel better, which ultimately is the most important thing, if we address it. And if it's not in the top 5, it's less likely. But of course, it's subject to interpretation from an experienced provider. But In terms of the pathophysiology of ME/CFS, if you had asked me that question 6 months or a year ago, I probably would have given you a very different answer. I probably would have focused on the viruses and cell danger response and leaky gut and systemic inflammatory processes and again, heavy metal toxicity. There's just so many things that can be contributing. But long haul COVID is in a good way has blown it all up. And now this new paradigm of microclots and inflammation and arterial, disease with microclots and hypercoagulability is, I would be surprised if it didn't shift so I'm starting to do a series of labs. I have my own set of 5 or 6 labs that I started to do for people: von Willebrand's antigen, D-dimer, fibrinogen. So I have my own based on the researcher Pretorius Patterson, Ann Corson, who many of you might know, and others. So I'm doing my own profile, and I have maybe 5 or 6 people on regimens who meet criteria for ME/CFS with or without fibromyalgia. So I'm just jumping in there, and as long as I think it's safe. I'm not using a Pixaban because I think that's a bit dicey for me to start using blood thinners on people, but I have a couple people on Maraviroc with statins, and I'm using, Ann Corson really recommends different systemic enzyme therapies, serrapeptase, lumbrokinase, nattokinase. So I'm starting to work, trying to take the best of all 3 of them and put together as best I can. So that it's going to be very interesting even to see what happens in my group for the next 3 to 6 months, see how this plays out. So long answer. Sorry about that.
Exciting. No, thank you. That was very informative. And one person asked if you have any experience with post-exertional malaise or professional working experience with post-exertional malaise, which is, really the distinguishing factor for ME/CFS. And, is there anything that can help with that or any kind of treatment?
Well, that's an interesting one, because if you asked a naturopath or a functional person, especially a naturopath, but if you asked them that question, most of the last 25 years, they would have said the person had an adrenal issue, adrenal fatigue, that would be one of the most reliable. And that's what I said for years, again, because I'm always trying to learn from whoever I can learn from. That was like the classic, most reliable indicator of adrenal fatigue and low cortisol states was post-exertional malaise. So what we often see is we'll have this end point, post-exertional malaise, and depending on the person's background, experience, or perspective, they will think about it and interpret it and in a very different way. So some people say, well, absolutely, that's ME/CFS. Other people say, no, that's adrenal. Other people say, but I think that is one piece that could have many potential causes and contributors. And it goes right back around that everybody needs to have a thorough, comprehensive, methodical process, as efficient as possible. You can't really rush it. I mean, sometimes you pick up things early, but that really the goal would be to get everybody through, exploring anything and everything to see what shows up.
Yeah. There were a couple of questions about mold being a contributor to these things. And I know working with the Lyme community, that comes up in so many of my patients too. I'm obviously a mental health provider, so I have no take on that, but I'm curious what you have to say about that.
Major blockbuster bonanza issue. However, well, there are not that many people that are versed in it, so it's very, very hard. The only certified person is the woman in Southern New Hampshire who's certified through Shoemaker, but of course, there's the Shoemaker group, and then there's the Brewer group, and then you have Neil Nathan in the middle trying to sort it out. And so that's the hard thing, is these are all very complicated subjects, and you're going to get very different opinions and approaches. when I talk to people about mold, I say, okay, you can have four potential problems with mold, and you could have any combination of these. You could have mold allergy. You could have mold infection and overgrowth, which Shoemaker dismisses, but plenty of other people think is real. You could have mold toxin illness, so-called chronic inflammatory response syndrome, which is, some people in the traditional world say, oh, mold, there's no research behind that. There's no evidence. And they have no idea, apparently, what Shoemaker's like, because he's been doing this work for 20 years. A lot of really smart people in on this for a long time. And Shoemaker is an absolute fanatic about research and evidence, and is intolerant of anything that is not science or research based. Everything else is fluffy nonsense to him. So we have allergy, we have infection and overgrowth, we have mold toxin illness, and we have oxalates. So fungal species can make oxalates. Oxalates can build up in tissue. Here's one thing I'll say as somebody who's pretty experienced in medicine and fairly experienced in functional medicine, integrated medicine. There are so many times when I'm reading, learning, doing everything I can to understand something. And I think, okay, this is beautiful. This is it. I'm going to be able to help so many more people now that I understand this. Well, actually, what normally happens is the first person I manage does well. I said this to a patient this week, and she said, well, maybe you're so enthusiastic that it's placebo effect. And I said, yeah, I don't know, but I see that over and over again. So the first person does really well, whatever it might be. It could be oxalates, mast cell activation, mold toxin, whatever.
Yeah.
And then reality sets in, and you realize, it's so complicated. It has to be done in a certain order, and the testing is expensive. And I don't want to recommend $300, $400, $500, $700 worth of tests. I feel responsible. Like, I'm not going to just say, well, you know what, you better be interested in your health or else not my problem. Like, I'm never like that. So it's just, it's hard work, and it's gratifying work. And when it goes well, it's the greatest thing of all, because you help people that are very frustrated and struggling. But there's some piece of this. And again, I'm an optimistic person. I hope the long haul COVID is going to provide it, but there's some piece or pieces that are elusive, and it's very hard. Like, so many times I thought we were home free and we weren't. But another long answer. Sorry, I can't be brief. I don't know. So.
I know they're complicated answers too.
Yeah, sorry.
And we have a lot more questions, so I'm just going to pick out a couple. I'm sorry we can't get through them all today, but I can't imagine going to my primary care and asking them about mold and them just looking at me like I have 10 heads. And we've gotten a lot of questions about where to find a functional medicine doctor in Maine, a functional medicine doctor in other I think in around the DC area. And it's just like, it's really frustrating that to those of us like myself and others here today are now learning about how great functional medicine can be and how many insights it can lead to, that most doctors are not aware of it at all. And what do you think is needed to bridge that gap in functional medicine and traditional medicine?
Yeah, it's a tricky one. I mean, what's gone on with the naturopaths in the last 30 years since the 70s is very interesting. Okay, I won't tell the whole story because that'd be another 5 minutes, but they were on the edge of being extinct. There was like one school, I think it was probably Bastyr, they graduated one student in like 1974, and the naturopaths resurrected it, saved it. And now there are more and more states where naturopaths can be primary care physicians, and the insurance company has to pay them for their services. So for us to bridge the gap, I think the naturopaths have been doing this work for 25, 30 years, trying to get credibility, trying to get the insurance to cover them. It can't be private pay. I mean, functional medicine is too expensive, too complicated. The new people into functional medicine, again, I say this but are often over managing things. They're picking out they're in the weeds, managing every little abnormality. Well, this is down to, this is high normal, that's low normal, and they're putting people on 7 to 10 supplements for 14 different things because they don't have context, they don't have clinical background. So really what would make the biggest difference is if insurance covered functional, integrative, naturopathic providers as primary care physicians, and covered the testing. One of my 100 dreams, which I probably will never pull off, is to do a study showing how cost effective it can be. In my first book that I wrote, there was, and I'm almost done, there was this amazing study, and I'm gonna try to get the gist of it. In the Pacific Northwest, which is the epicenter of naturopathic medicine in the world, by my understanding, they did this study where they took a groups of patients, and I don't remember the number, but they, over time, they had some of the groups patients managed by MDs and some of the groups managed by naturopaths. So by every quality of care measure that they could think of, the patients being managed by naturopaths did better in every measure: patient satisfaction, clinical outcomes, admissions to the hospital. So the naturopaths were superior to the MDs in every measure, and at 10% of the cost.
Wow.
So if that's true, if that is representative of what would happen, if the MDs knew about it, they would lose their mind. I mean, it would be, I don't know, it would be like, I don't know what they would do. I don't know what the regular MDs would do. Yeah.
The fraction of the cost, was that the fraction of the cost of what patients paid, or just the cost of the treatment itself?
The cost of everything. Yeah, sort of the whole thing.
Patients end up spending so much because it's not covered, but actually the treatment of everything is a lot cheaper, right? Is that, I mean,
yeah, because they fixed people, and because the herbs cost more than an echocardiogram and an MRI and a CAT scan and surgery and all that stuff. And Sharon, you had something to say?
Yes, I think you were right. And I mean, I applaud you for trying to help patients under insurance coverage. In Washington State and in Vermont, I know that naturopathic and functional medicine care is reimbursed by insurance. You know, and some of the tests are, some of the tests aren't. I mean, I have been prescribed drugs, you know, conventional things by functional medicine providers, including naturopathic doctors. I really wish more states like Massachusetts would, you know, really open up and allow more of these practitioners to practice. I really wish the insurance companies would cover more. But I think there's got to be also a groundswell of patients demanding it. And I think your idea to have a study showing how effective it is would be very worthwhile.
Yeah, it's going to need to be proven to them. Yeah, the MDs, you know, not saying it's a bad thing. They like you can't just tell me that something sounds nice. You gotta prove it to me.
But I have been to several conferences now where I have seen MDs who, you know, like you, have seen that they wanted to help patients more and got into functional medicine. And then the stories they tell have just been amazing. So, you know, I know you're not alone, and I've just been thrilled to see more people getting involved with it.
Well, and almost, by my understanding, almost everybody that goes into functional medicine from the MD side, it's because there's something personal. Mark Hyman was sick, nobody could help him. Teitelbaum, you know, one after the other, after the other, after the other. I bet you if you surveyed 100 functional MDs or NPs or whoever, DOs, chiropractors, you know, why did you go off and do extra work? I mean, it's much more complicated, much more difficult. I mean, regular primary care is a cakewalk compared to it. Not that I would give it up. Of course, I love the work, but it's a lot more work, a lot more time. But I bet you, my guess is that over 90% of people would have some personal story of somebody, either them or somebody they knew, that was not served, like you're sharing, like your experience, you know, and you're trying to find the best of both worlds, like most people would. And so.
true. And I also, my life was saved. I healed from a really bad chronic illness myself through functional medicine. So I really appreciate you, Dr. Lenhard. And Sharon, you're amazing as well. There were a couple of questions for you. One was somebody wanted to know if you're comfortable sharing the alternative to Mestinon that you had mentioned.
It's a supplement. I use the Source Naturals brand, but there are other brands. And it's called Huperzine A, Huperzine, capital A. And it has basically the same mechanism as Mestinon, but for me, it doesn't have the allergens Mestinon did.
Okay.
And I have, less side effects than when I tried to get it compounded, which you can't compound it anymore.
And what states, this is my question, what states did you say actually cover the functional medicine?
My family's gotten it covered in Washington State and Vermont. There may be other states. I think California is fairly progressive.
Yeah. Well,
I think my last count, it was like 15, 16, 17 states. Like I went to a naturopath conference like 7 or 8 years ago, 240 naturopaths and me. I was the only MD there. It's funny. I went up to the organizer. I said, "How many MDs are at the conference?" He says, "1." I said, "Oh, okay. That's me." But that was a big, they were really talking about that, political grassroots kind of movement, and they're keeping track. And I could be wrong, but I think it's like 15, 16, 17 states from zero. And Massachusetts is going to be one of the last. I mean, New Hampshire, Vermont, Maine, obviously the many more integrated practitioners, naturopathic practitioners take up residence in those places because Massachusetts is hyper traditional. And, when I say belly of the beast, I mean, that's part of it, that I think Massachusetts will be one of the last,
Yeah. I was impressed that I think there was a bill passed for coverage of private insurance coverage of chiropractors and acupuncture, which is maybe like a small step, but
no, it's a good analogy. You're right.
Yeah, I mean, I remember sitting on the hearing for that, and I really hope that we can, I'm happy to get involved more in the advocacy because it's definitely huge, and it would help this population so much, many populations, I think. So just a last question, and this maybe goes for both of you, and another one that I'm really interested in is what you have to say, about mental health. I mean, Sharon, you living through this has got to be, and caring for loved ones that are living through this has got to be so challenging in so many levels. And, we want to know, like, do you have any suggestions for coping with that? And how what has helped you get through all of this?
Well, I'm a big fan of mindfulness, there are mindfulness programs, et cetera. Getting as much exercise as I am capable of, I look at this as a marathon, and, I'm not going to win the race on any particular day, but just keeping myself in as best shape that I can throughout this. The other thing I've learned mentally is I have experienced depression, anxiety, just feeling off, lethargy. And what I've really learned over time is that it's biochemical for me most of the time. So I report my symptoms to my functional medicine doctor, and that's actually how I found this Kuvan drug, because I was very low in dopamine, and this BH4, which is the chemical substance that Kuvan is an essential cofactor for making neurotransmitters. It's also essential for many other body processes. So that, like things like folate, B12, but getting, dialing in and getting that right. And, just making mid-course corrections by reporting symptoms to my providers has been tremendous. And the same thing happened with my daughter. And so that's how I knew to look at biochemistry.
Yeah. Wow. Interesting. Dr. Lenhard, do you have any words about the whole mental health or even?
Yeah. I used to say that among the medical specialties, there was a 10-way tie for last. Then I said, psychiatry has that position all by itself because they don't even do any testing. I mean, there is no colonoscopy, there is no chest x-ray. Nobody gets any testing at all.
No,
talk about a discipline that's based on trying to lump people together with a diagnosis and then manage them in a similar fashion. But so like everything else, and I have to remind myself of this all the time. We always want to start with the foundation and then work up from there. So we wouldn't want to do, $1,000 worth of tests and do exotic things and put people on 7 supplements and 3 meds. If the basics of relationships, sleep, diet, gut health, being outside, mindfulness. So everybody, no matter what their issues, in my view, has to make sure the foundation's in order, because if you're stressed and you can't sleep and your diet's horrible and you're staring at a screen all day and you're cooped up and you have anger and resentment and you have problems with relationships in your life, well, what's a supplement or what's organic acid profile going to show us? I mean, so for everything, including mental health, we start with the foundation. I used to say that exercise was the #1 antidepressant, especially based on the antidepressant trials that have never been published. And that might be true, but of course can be insensitive to say. I would never say it to somebody who's tired and they're like, what are you talking about? But yeah. And then I would say beyond the foundation, it really has to be individualized. Like Sharon did well because she had low dopamine. Well, some people are in low dopamine state, some people in high dopamine state, some people low serotonin, high serotonin. Some people do really well with methylated B vitamins. Some people do worse. Mm-hmm. So the idea be like, you can just say, well, let's just give everyone B vitamins, or let's just give, I'm not saying you were saying that, Jeff, I'm saying, let's just do this or let's do that. I mean, that's the goal of the functional integrated naturopathic paradigm, is to individualize treatment as much as possible beyond the foundation. So I think, which is more complicated, takes more time, and requires a completely different training background, which is part of why it never happens, or it doesn't happen too often.
Yeah. Well,
but we are all individuals with individual genetics and environmental factors. So it makes sense to individualize medicine and treat us as individuals and, not as carbon copies of one another. And I think that's been the problem with like evidence-based trials, because people are not widgets. And so the doctors, one thing that hasn't been said enough here is having a doctor be able to spend 30 or 45 or 60 minutes with you is just a gift, because they can learn so much about you. And, if they have the algorithm you've got, Dr. Lenhard, that's fabulous. But, I've dealt with people who have the experience to be able to zoom in on different problems just by getting to know the patient. And that's so critical, which it just doesn't happen enough in allopathic medicine.
Thanks so much. Well, this was so informative. A lot to take in, but really incredible. And I'm probably gonna have to watch this again once it's up on the website. Thank you, Sharon, for sharing your experience. And thank you so much, Dr. Lenhard, for sharing all your experience and all that information. We are now coming to the end of today's session. This recording will be shared on the Mass ME/CFS YouTube channel in a few days. So watch for the email about that. The topic for our Sunday conversation in April is working with your healthcare provider. The date is April 24th at 4 p.m. Eastern time. This is the last Sunday in April, a week later than usual, so as not to interfere with those who may be celebrating the Easter holiday. The featured speaker is Dr. Alba Azola, a physical and rehabilitation specialist at Johns Hopkins University School of Medicine, who also works in a long COVID clinic. Those of you who saw the January presentation have already met Dr. Azola. This is a large topic and a complex one, so please join us. If you have ideas for future programs or speakers, please email events@massmecfs.org. Sunday Conversations is not intended to be a series of research presentations, but rather programs that will provide a variety of practical information that patients and families need and want. If you would like to join the Sunday Conversations team, please email volunteer@massmecfs.org. We are working on the fall schedule now, so please let us know. Finally, if you have found this program worthwhile, there are a few ways you can help. You may make a donation to help support this series by donating online at massmecfs.org/donate. On the same page, you can sign up for our newsletter. And if you donate $25 or more and check to become a member option, that will establish or renew your membership, and you will be invited to our members only programs. Thank you all for coming, and we hope to see you again next month.